Marathon training is tough, but running through pain during that training is one of the biggest mistakes that we see in our endurance athletes here in South Florida. Hi, I'm Dr. Gage Winkles. I'm a sports chiropractor here at Health Fit Chiropractic and Sports Recovery right here in Boca Raton, Florida. And today we're going to go over a case study that we see come into the office quite a bit, and it's revolving around the idea of kind of that mentality you may have as you're approaching your upcoming training for race season here. And that is, a little ache and pain. It's not stopping you from training at the moment now, so you're just going to push through it. We're going to talk today specifically about Achilles tendonitis. This affects a lot of runners, and we see this come into the office quite frequently here. And more often than not, when we ask the question, so how long has this been going on? We hear 3 months, 6 months, 2 years, right? Time periods that are far, far too long for you to now just be presenting to our office. So when we look at the Achilles tendon here, you can see that on the back of the legs here, we have two major muscle groups that will feed into the back of the leg. That's your calf muscles. We have the gastrocnemius here, and just underneath that, a little bit closer to the lower leg bone, we have the soleus. And these work hand in hand here. And you can see that the gastrocnemius connects here down to the Achilles tendon, which oftentimes when we see present with pain can be down at the back of the heel, maybe even some swelling due to this bursa being here. We have mid-portion Achilles tendonitis, which is right in that thick fibrous tendinous tissue that you might feel where shoes are rubbing on the back of your foot. Or we can have Achilles tendonitis more up towards the calf in the proximal portion here. And all of this is treatable non-surgically and non-invasively if we get on top of it and treat it correctly. And you do due diligence by coming in before it's turned into a chronic issue. That's not to say that if you've been dealing with this pain for a year, 2 years, 5 years, that you don't have any sort of resolution that we can find. However, coming in early is so important in these types of injuries as you're in your marathon training. What we like to do in office here is first assess, are we in an acute phase of care or are we in a chronic phase of care? Then we'll go over how we're going to best help you get rid of that condition so you can get back to training for that upcoming marathon pain-free. What that can look like in the office here is personalized one-on-one rehab that either a doctor or someone on our care team, one of our rehab specialists, will do with you. We'll go over that rehab with you with proper coaching and making sure that you can do some rehab exercise to help in office here, but also doing some exercise on your own outside of the office to get back to training faster. Other tools we have in the office here are things such as Graston, which is muscle scraping. Active release technique is a phenomenal soft tissue technique that we utilize in office here. And then a new treatment modality that we've been using in office now that has excellent clinical success is shockwave therapy. That helps reduce pain and inflammation and increase stem cell recruitment to actually repair any damage along that Achilles tendon. And then what we want to do is also help you return to sports. We want to make sure that if you've had to take a small break from marathon training or you need to keep training because that race date is approaching, we want to help you manage that load and recovery leading up to that day so you can cross the finish line and successfully complete that race. If you have questions about how we can help you prioritize getting care when it's needed and not just ignoring that pain and allowing it to turn into a chronic condition, give us a call today and we'd be happy to chat. Take care.